Proszę powiedzieć, szpiczak nogi, co to za choroba? Czy jesteście w stanie wyleczyć pacjenta, czy spowodować, przedłużyć możecie, tak żeby stała się to choroba przewlekła?
Okay. Multiple myeloma is the second more frequent hematologic cancer. The typical features of this cancer is osteolytic lesions, renal failure, and anemia. If we talk about curability, I'm happy to say that 2-3 years ago we really changed our mind because the treatment is so successful that probably 10% of younger patients could be really cured. We're still waiting for final proof, but we think it's true. But in meantime, the most patients are undergoing several courses of therapy, first line until fifth, sixth line, and there is significant prolongation from 5% of survival, 10-year survival in the middle of 19th to like 40%, 10-year survival up to now.
Czy można powiedzieć, że to leczenie jest przełomowe? No właśnie, co zmieniło się w leczeniu szpiczaka nogiego w ciągu tych kilku lat?
There are some really important things which significantly involve the course of disease. I have to say we have still simply 5 key drugs, which from the past was glucocorticoids, dexamethasone and prednisone, and alkylating agents, especially melphalan and cyclophosphamide. So there's 2 groups of drugs, and then we add in the early 19th autologous transplantation as a very important treatment strategy for patients. And then we add any 5 years from the beginning of this century one key novel agent: thalidomide, bortezomib, lenalidomide, pomalidomide, carfilzomib, ixazomib. So, and each of this drug add 1 year more for survival. So this is the reason why we really prolong overall survival of these patients if we can offer these novel agents to our patients. Because whenever the patients became resistant to all available drug, then if some novel agent is available, it's estimation that 1/3 of patients, these resistant patients, is still sensitive to this new drug. So that's the story about success in myeloma during the last 10 years.
Proszę powiedzieć, czy czescy pacjenci mają dostęp do tych leków? No właśnie, jak wygląda dostępność do nowoczesnego leczenia onkologicznego w Czechach?
Of course, it's one of the challenging issue for all of us because we are facing on the one side, as I said, significant improvement and progress in the treatment. On the second side, and this is the dark side, the cost of this treatment is enormous. That's true, and we really need to discuss these things together inside all Europe. So, if we specifically talking about Czech Republic, I'm really happy that the situation is really quite good. So, after approval by EMA in Europe, we have still some significant delay, but the delay is less than 1 year. So, and this delay is time for discussion between Ministry of Health, our regulatory authority, SUKL, and insurance company about price, reimbursement, cost, and also some limitations. The limitation is a very, very tricky point, and I'm always not happy to see many limitations for any novel agents because this is against patients. So the situation is quite good. For instance, the bortezomib lenalidomide is available, pomalidomide starting to be available. Of course, carfilzomib and these new novel agents, which I already mentioned, are still not approved in Europe. So generally, Europe has some delay and it's always behind states, because whenever any drug is approved in the states for any type of treatment, like for relapse, then it is already used for all patients in all settings. So that's it. But situation in Czech Republic, fortunately, is quite nice.